reports today, and they're accurate, that at a time when team sports have actually been brought to a halt, there is one team that has worked very well together, and that is the community of New South Wales, the health staff across the state, and of course the New South Wales government. Together, only a matter of about 2 months ago, we couldn't have imagined that we would be doing as well as we are. We certainly had concerns that we could have been up in the order of 700 deaths, possibly more. But as a result of the incredible teamwork that has gone on with the New South Wales community, who have really heard the message about social distancing, they've listened to the 1.5 metre requirement, they've made sure generally that
Okay, our apologies for that, and that was the New South Wales Health Minister Brad Hazzard there, and he was really full of praise for people in New South Wales today, and that comes after yesterday rebuking those in the 20 to 29 age bracket for not really following the social distancing measures, but full of praise there today. A new batch of 60 million protective face masks are being distributed to frontline health workers, and we're going to hear a bit more from the New South Wales Health Minister Brad Hazzard now.
From the unions that on the basis of their representations and others who've come forward, the government has extended, in fact I just signed the health order, making sure that all workers now are protected with an additional $5,000 fine. So the short message is to those hopefully few people who still think this is an acceptable practice, if you cough or you spit on any worker in New South Wales, the police are open to giving you a $5,000 fine. And I, for one, would like to see that happen to anybody who thinks that's acceptable. I'm going to ask Dr. Chant to give more detail in relation to some of the health issues, and then I'll ask Assistant Commissioner Webb to talk about some of the policing issues, and then I'll ask each of the colleagues leading those two unions to also just give a few words about what their concerns are and why this has been necessary. So, Dr. Kerry Chant.
Thank you, Minister. So there were 21 new cases to 8 p.m. on the 18th of April and 4,683 people tested. There are currently 245 people being treated in New South Wales Health, including 21 patients in ICU, 17 of those are ventilated. There's been one death related to COVID-19 in the past 24 hours. A 93-year-old man confirmed positive for COVID-19 has passed away, and he was a resident of the Anglicare Newmarch House. And at that Anglicare Newmarch House aged care facility in Caddons, there are 9 additional cases. In total, there are 39 cases, 13 staff and 26 residents have tested positive.
Good morning. In the last 24 hours, police have issued more than 40 fines to those people who have breached those public health orders. In the main, they have been people that have been warned previously and not taken heed of that advice and have been issued a ticket. The second group are those aged between 20 and 30 who have been out without a reasonable excuse. Those people aren't invincible and they need to listen to the advice. It's not reasonable to drive halfway across Sydney or any other suburb to go to another location to meet up with friends. Overnight, police also had a cause to speak to a 25-year-old male from Nowra, and during that interaction, we allege that person spat at the police. That person is now before the court for a number of offences, including spitting at those police officers. We would ask that if anyone has information about people that are breaching the order, that they have the option to call Crime Stoppers, which is 1800 333 000. Thank you.
Bernie. Hello, Bernie Smith, State Secretary, SDA, the Union for Retail, Fast Food and Warehouse Workers. We welcome today's announcement of extending the $5,000 fines for spitting to retail workers and all workers. It's unfortunate that we need a law like this, but we do. Just in the last week, I've had 4 matters raised with me by members from across the state of people deliberately coughing or spitting on people. We've got a member down in the Illawarra area who was refusing somebody a product limit on a particular item so that everybody can have their fair share. And that customer spat on the face and in the mouth of their member. It's vile, it's disgusting, it's unacceptable. It's one of many of these examples. We're very pleased that when we called for these changes that the Minister reacted so quickly, and within a few days we now have this public health order in place. Retail workers matter. They're keeping you fed. They're somebody's son, somebody's daughter, somebody's mum, somebody's dad. They deserve respect. So not only shouldn't we not treat them badly, you should thank a retail worker. So next time you're in a shop, thank a retail worker. Just like all retail workers today, thank the state government for standing up for them.
David Babineau, Divisional Secretary of the Tram and Bus Division of the RTBU. I'd like to echo Bernie's points. It is absolutely welcome that we have a government initiative like this extending to people, certainly within the transport network. It's a daily occurrence anyway. It's a shame that it's taken such awful circumstances for this to come into place. We're all very grateful that it has. We'd actually, to be honest, like to see it continue. I think everyone's a bit sick of the kind of disgusting behaviour that's going on, and obviously the current circumstance puts it in a whole new light. I just echo as well, everyone that's doing their jobs, bus drivers, train drivers, light rail drivers, everyone on foot, station staff, you've got everyone at the ports, everyone within the transport network is doing everything they can to make sure that things keep running, that things are getting delivered to the supermarkets, that people are getting to the jobs they need to do, and you know, they deserve thanks too. So, yeah, please do. We have had an increase. There has been an increase in March. The actual figures aren't out for April yet, but certainly across the bus network there was an increase. It's up about 40%. It's putrid. It's absolutely putrid. There's no excuse for it anyway, let alone in the current circumstances. It's disgusting.
Questions?
Yes.
Dr. Chant?
So there's an extensive intervention in place, as I've indicated. When there is an incubation period of 14 days, and hence when people have been exposed within a facility, we will see the emergence of cases over that 14 days. We can't change those cases. Those cases have been infected. There's not a therapy we can give to prevent that infection. Our aim then is to provide high quality care to the residents, manage and support for the healthcare workers and aged care workers in that facility, as well as support their loved ones getting up-to-date information. But there's nothing we can do around preventing those cases, and I think this extensive testing that has been undertaken in the Newmarch House has identified the cases early. We now need to stop spread. So the facility is obviously managing it with high levels of infection control to prevent any further transmission within the facility. The Nepean Blue Mountains Local Health District is working to support the aged care facility with access to specialist care and testing and treatment for the residents to support their existing health infrastructure at the facility. Look, I think it's too early to say. I think the fact that we've done widespread testing gives us some hope that we've identified the current cases, but you make a very valid point, which is due to the incubation period, there may well be additional cases in that time frame.
Do we know how many of the residents who are sick? How sick are they?
Look, obviously, we have indicated that there have been the death in the 24 hours. I think that we've messaged from the beginning that it is very challenging in an aged care setting. As you can imagine, many of the residents of the aged care facility are elderly and have a lot of underlying health conditions. And so whilst we will provide support the provision of the highest quality of care. We know in this setting that there can be death can be a consequence.
Is New South Wales Health trying to do anything in terms of, I know that they're under the federal government jurisdiction for a nursing home, but in terms of writing to the feds and trying to work to see the stricter protocols of what workers so that this doesn't happen at another aged care facility?
There's been extensive work across the states and the Commonwealth.
Particularly what's happened after the Chant.
So I think this really highlights some of the incredible challenges with this disease in the fact that it can be quite mild, that you are increasingly we're concerned about people being infectious before onset of symptoms, and so it is going to be a challenge in terms of keeping COVID out of our aged care facilities in general. I've got to acknowledge the strong work that the aged care sector has taken. They've implemented a range of measures to reduce visitor numbers, to have screening of their staff going into those facilities. They've had extensive communication to visitors, as well as upping infection control and cleaning. All of these are important strategies in reducing the risk, but the risk can never be zero, and that's why we have to be incredibly vigilant. And again, if I can go back to my comments earlier in the week, it's incredibly important that this disease can be mild. So if you are an aged care worker, if you're a disability worker, if you're a health worker, even if you have minimal symptoms, just a little bit of a sore throat or a minor runny nose, don't go to work, get tested. That's the safest option. I suspect it may be the same deceased. I will confirm that. We just obviously report our numbers in a 24-hour cycle, but obviously the aged care facility releases its information as it is wont to do. Yeah. At the moment, our actions have bought us significant time for health system preparedness, for the capability to increase our testing, our capability to secure supplies of personal protective equipment, and to also look at whether we have new emerging therapies that may be useful in treating COVID-19, and also to learn how best to manage patients to get the best outcome. These have been important strategies, but the end game in the end is going to be if we have a vaccine that is highly efficacious, that we have sufficient volumes of, that we can immunise the community, and ideally that vaccine would be long-lasting and not requiring annual vaccines. It's my desire for all vaccines to be so effective. Or an effective drug that potentially, if we had drugs that could prevent people getting the disease, or particularly our high risk, that would really assist us, or if there were therapies that could be used to more effectively treat that proportion of people who have a very severe disease progression. So at the moment, we have the benefit of looking to the many northern hemisphere countries and looking at their trajectory, learning what they've done well and what they have not done so well, and hopefully with a partnership with the community, we've got to navigate our way through this. But just to echo the Minister's comments, this is going to actually be a very long game, and we do need the community to understand that those social distancing measures, the need for good hygiene, those measures about not going to work or workplaces when you have even minimal symptoms are going to be with us for a very, very long time. I'll have to follow that up, but we'll update you if that's the case, yes. Look, at the moment, we've been doing extensive testing on board the ship, both PCR testing, which detects the presence of the virus, and then antibody testing, which gives us an idea of the immunity, and that's to give us a very comprehensive picture of the ship to inform the decisions around the departure. So basically I believe that there's been no new cases of symptomatic crew in recent days. And one of the challenges is that the test results have to be looked at in combination. So, for instance, we know that our tests are incredibly sensitive at detecting the virus, and one of the real challenges for us is to understand whether that means that those people are still infectious or whether they've just got dead virus remnants in the back of their throat and are not infectious, but because our tests are so sensitive. So what at the moment we're doing is cross-checking the results on the PCR test with their antibody response to better understand that, and that process is undertaken now, and we hope to have those results finalised in the next few days.
What needs to happen for North Crew to be taken off that ship so they can be flown home and have sign off on it? What needs to happen and what needs to happen?
So the considerations that health have is around the capability of the medical infrastructure on the ship, and there is a very highly skilled, capable, intensive care trained doctor on board the ship. They have very actually high-end capabilities on cruise ships. As you can imagine, they have to deal with a lot of unexpected events in cruise. Also that they've got sufficient staff that where there's no risk of infection, the key staff that need to drive, I'm sure there's a better word than driving the ship, but the key staff that need to maintain the function of the ship. And also we want to make sure that the disease outbreak is under control on the ship and that there's no ongoing cases. And so they're the considerations we put in. I would like to say that this is really a partnership. Australian Border Force is leading this with Aspen Medical, working very much with New South Wales Police and with New South Wales Health having input. And so really some of those questions really need to be directed at Australian Border Force.
What about the North Crew members on board the ship who want to get off and fly home? Police say, or the police commission says that you can facilitate that repatriation, but you need sign off from New South Wales.
So rather than talking about the specifics of the Ruby Princess, healthy people can fly provided they're not infectious and don't place other people at risk. So the assessment would be, are they currently infectious? And if they're not infectious, and then we're happy that they haven't been recently exposed to anyone, and as I said, the disease outbreak appears to be very well controlled at the time, then those would be the considerations for on-flying. That's a matter for Border Force. That's your assertion that they're making that comment. I mean, the reality is that's consistent advice. We have very clear guidelines on who can fly, and those would be the factors that would be under consideration. And there's no issue with us giving guidance as to, so that's in part of the national guidance documents developed by CDNA in terms of who is safe to fly. There are other considerations around, are there flights available? But I really think those questions are best drawn to Border Force. We meet daily. Border Force, New South Wales Health, Aspen Medical meet daily to work through these issues.
Has been in discussion with consulates for some time, and if you remember, the ship has been under the Aspen Medical plan for 10 days, so that 10 days hasn't been completed yet. So no doubt there's lots of work, and as Dr. Chant said, discussions every day about what those plans might look like when that plan is completed. So there'll be, not sure of the date, but it was 10 days from when it came in, so it'll be up shortly. But no doubt there's lots of plans because there's crew from different parts of the world about how to repatriate them, and etc. So it'll be a great body of work given that there's about 1,000 crew on board. They're being developed, and that will depend, as mentioned by Dr. Chant, based on who's essential crew, who wants to go home, and who's happy to travel in some other way. So it will depend. And